Let me go over some of the basics with stretching. Stretching is one of the most underused therapies in the United States in today's world. With stretching, some people believe you can relieve up to 50% of the pain if you stretch on a regular basis. But again, the average American doesn't do a lot of stretching, and other cultures, they actually do a lot more stretching than we do. But stretching, what it does is it elongates the muscles, and sometimes it can help break up scar tissue too with the stretching techniques. And scar tissue, basically what that is adhesion. So anytime you have an injury, scar tissue starts to form in that area to help protect it. But it does great at protecting it, but over the long time, it compresses that area, so you want to get more range of motion, so that's why stretching is more beneficial. Some of the basics with stretching, everybody's belief is a little bit different how long to actually hold the stretch then. So some people, when they bring up the stretch, those do like 2 to 5 seconds, bring it back a little bit, and then bring it up a little bit farther, kind of thing, for 2 to 5 seconds, push a little bit farther. But anytime the person feels any kind of burning sensations, make sure you stop that stretch. And sometimes people can develop some cramps during the treatment. So just make sure you ask them what works better when they have a cramp. So is it better to stretch out that area, or compress that area, or kind of vibrate that area? But everybody's belief is different on what helps relieve that cramp area. So if the body's not used to it, sometimes it can go into the cramp mode then. So again, some people will hold this for 10 to 20 seconds even for a stretch. And everybody's range of motion is different, so you want to test out one side and then test out the other side too, to see if there's any difference. But the area that you want to test out the most is the unaffected side. So let's say they're having right leg pain, you would want to test out the range of motion in their left leg first, and then the right leg, test it out, so you can see if there's a real difference. Because again, everybody's range of motion is going to be different, but you want to compare the good side with the bad side for the stretch then. And stretching, Golgi tendon organ. The Golgi tendon organ is pain receptors at the end of the muscles. And what the Golgi tendon organ is, anything over 2 seconds, it kind of lets you know that it's too painful. So that's why a lot of fast stretches are based off of the Golgi tendon organ. So anything over 2 seconds of holding a kind of a quick stretch, it's a little bit painful for them in those areas then. So let me demonstrate some different types of stretching that you can perform, but all these resistive kind of stretches can be performed in all these other stretches that we performed on the body then. So what we're going to do first is PNF. It's called proprioceptive neuromuscular facilitation. So again, most people just say PNF. So with this one, people's belief is a little bit different too on how long to actually hold it, how much to actually resist. So it all depends on what the client is used to, how comfortable they are with it. So with the PNF, we're going to bring it up like this and have the client push against you for 5 to 10 seconds or so. So they're going to resist you. Then after that, bring it back for a couple seconds, and then try to bring it back a little bit farther then, and have them do the same thing. So 5, 10 seconds or so, have them to kind of push against you then. But if they're pushing too much and they're actually winning kind of thing, have them just push with just a little bit of their strength then, so it's not making you look bad then either. So that's PNF, so each time you're pushing it a little bit farther each time for the stretch then. Next one, it's called reciprocal inhibition. Reciprocal means opposite as in math. So with reciprocal inhibition, we're going to perform the same stretch. I'm going to bring it up like this, but the antagonist muscle, so the hamstring we're stretching out right now, but the quadricep is the antagonist muscle, it's the opposite. They're going to contract that area. So they're going to contract that area for like 5 to 10 seconds. You can even go longer if you want, but again, if there are ever any burning sensations, back off on that. And then you relax for up to 2 seconds, and then you're going to bring it a little bit farther then, and have them contract that area again then. So the goal is you can perform that 2, 3, 4 times, and a little bit farther each time then. But again, any kind of burning sensation, stop that stretch then. Okay, next technique, we're going to perform crack, it's called. Contract, relax, antagonist, contract. So contract first, so just like this. So just like in the PNF, so 7 to 10 seconds or so for resisting, and then relax it for 2. So contract, relax, and then the antagonist, we're going to bring it up, and then push a little bit farther, and then they're going to, antagonist muscle, they're going to contract, so they're going to kind of bring it towards them, so you shouldn't feel any resistance. So it's basically PNF and then reciprocal inhibition. So again, PNF and then reciprocal inhibition, so just keep going back and forth then. So I'll demonstrate that. So again, they're going to resist, push against you for 5 to 10 seconds or so. And again, make sure you stop at the same time. So you tell them relax for 2 seconds, 1, 1,000, 2, 1,000. Bring them back a little bit farther, and then have them try to bring their quad to their body. So have them bring their leg to their body then. So 5 to 10 seconds or so. And then relax, bring it back a little bit farther, and again have them do the PNF then. So it's this back and forth with the crack then. So again, contract, relax, antagonist, contract. There's different variations with the contract, relax, antagonist, contract too. Okay, next type of stretch, we're going to have the client win. So with this one is we're going to bring it to the full range of motion, and we're going to have them resist and let them win for like 5 to 10 seconds, have them push down on the table. So 1, 2, 4, relax for 2 seconds, 1, 1,000, 2, 1,000, try to push it back a little bit farther, and then do it again. But again, make sure they're not tensing up while you're performing this kind of technique. So again, that's client wins for that. So it's a little bit of a muscle building too, in a way, if you want to look at it that. Next one, therapist wins. So we're going to find the full range of motion. So again, find the full range of motion, bring it back about halfway. Have them resist just a little bit, but have you win. 2, 3, 5. Relax. 1, 1,000, 2, 1,000. Okay, go on. 1, 2, 3. And you try to bring it up a little bit farther each time. So again, the therapist wins for this kind of technique. And again, make sure that they're not tensing up, so that's when you can possibly injure muscles, is when they're starting to tense up in those different areas then. Next one, active isolated stretching. This is a 2-second stretch, so it's basically 2 seconds of them helping out, and then 1.5 to 2 seconds relax. So you just keep doing that. So you do repetitions of like 10 to 15 repetitions. So with this one, what you're going to do is you're going to bring it up like this all the way, and have them try to bring it towards the body for 2 seconds. 1, 1,000, 2, 1,000. Relax. 1, 2, and then again they're going to bring it towards the body. 1, 1,000, 2, 1,000. 1, 2. Again, 1, 1,000, 2, 1,000. 1, 2. Again, 1, 1,000, 2, 1,000. 1, 2. 1, 1,000, 2, 1,000. 1, 2. But again, 10 to 15 reps you can do for each stretch. You perform with that, so you can perform it on all areas of the body. So all the stretches we went over today, just practice out the active isolated stretching then. So active isolated stretching, they can see a lot more improvement a lot quicker, so that's what's nice about it. And you're just giving them a little bit extra push is what you're doing with the active isolated stretching. So a lot of people just abbreviate things too, so the AIS, so if you ever hear that term AIS, or active isolated stretching, so you're just isolating an area and you're stretching it out then for that then, okay? Let's go over some actions of the foot and the stretches. So first one, we're going to do toe extensions. So toe extension is like this. So you can bring one toe at a time, or you can do a couple toes at a time, or you can do all the toes at a time to help stretch out those areas. Toe flexion, just bringing them down like this. So again, you can go one toe at a time, a few toes at a time, or all the toes at the time. Next one, toe abduction. So abduction means bring away. So you're going to part it like this, so you're stretching out this area. And just be careful if you notice any cracks between the toes. So you don't want to be stretching out those areas if they have any kind of athlete's foot or dry areas in those regions. Okay, next one, we're going to perform toe traction. So you're just going to pull that area. So it doesn't look like a stretch, but it's actually a stretch. So we're just going to pull the toes then. Next technique, you can pull, you can traction again, and also twist in one direction, or pull and twist in another direction too. Next one with the foot area. This helps out problems with flat foot, also shin splints, because with the tibialis anterior, so we're going to stretch that muscle out even though we're performing it right here. So I consider it more of like a snake bite. So what we're going to do is supinate the foot like this and pronate the calcaneus area. So you're stretching it out that way. Or you can do the opposite. You can just go back and forth to help stretch that out. Especially people that are more fatigued in the feet or on their feet all day long, they really appreciate these kind of stretches. Next one, we're going to perform dorsiflexion. So with dorsiflexion, it's going to help stretch out the gastrocnemius and the soleus region on the posterior calf area. So I'm going to compress here and stretch it out like this. So if you didn't compress this area first and just did the stretch like this, you'll be pushing into the knee too much. So again, compress here, not on the tibia bone, compress and dorsiflex. Okay, the other direction, plantar flexion, we're going to stretch out the tibialis anterior here. So we're going to compress here again. So again, not on the tibia bone. Don't put any pressure really on the bony area. So we're going to compress and plantar flex. So again, this is plantar flexing because you're planting. And this is the plantar side of the foot. And again, this is the dorsal side of the foot. So again, compress and then plantar flex. Next one, we're going to stretch out the peroneus muscles. They're the lateral muscles over here. So we're going to perform inversion. So we're going to kind of pull this way a little bit and perform inversion to help stretch out the peroneus muscles. So in sprains, that's the area after a few days after it's healed, then we're going to stretch out that area. So we're going to compress and push this way then to stretch out the tibialis anterior, we're going to push into the peroneal region and perform eversion. So again, push in here and perform it like this then. Another option of plantar flexion, we're going to go here and just bring it down right here so we can stretch out the tibialis anterior muscle then. And anytime with stretching, just make sure you watch their body reactions. If they ever move or twinge a little bit, it's more likely too much pressure, so communicate with them too with stretching. Okay, next one, from the top and the bottom of the foot, and just perform traction of the whole leg. So this helps the gluteal muscles, the piriformis, also a little bit with the quadriceps, the hamstrings, psoas a little bit. So you're just going to pull and traction. Or you can pull and twist one direction, or pull and twist in the other direction. So this is internal rotation, this is external rotation out this way. So again, just lean back and pull in. Okay. Now for the whole leg area, I'll show you different stretches for this region. So the first one, the basic one, we're going to stretch out the hamstring muscles. The hamstring muscles on the posterior side here. So what we're going to do is compress the quadricep area, hold on to the posterior ankle, and bring it up here like this. So again, this is a great stretch for the hamstring muscles, the biceps femoris, semitendinosus, and semimembranosus, those three muscles. Okay, next one, we're going to flex the knee, and you can also stretch out the hamstring area here. So you're going to push down and just hold. So with stretching, it all varies. Sometimes you can hold the stretch for 5 or 10 seconds. Some people believe 20 to 30 seconds. It's more of a belief system, what the client wants and what you want out of the actual stretch. But again, anytime it's too painful for them, make sure you slowly come out of that stretch. Next one, I'm going to put her foot right on my anterior deltoid region. So I'm going to hold the knee, hold the quad, and bring it down like this then. So I'm stretching out the gastrocnemius, soleus region, also a little bit of the hamstring area too for this type of stretch. So you're just using more of your body weight, so it's like you have a third hand is what you got then for that area. Next one, we're going to externally rotate, bring it like this, put it right on your anterior superior iliac spine, so that bony lamb right there of your hip. We're going to push down here, but also compress the quad at the same time then. And if you want a little bit more, you can just walk it in a little bit. And if you rotate your hip like this, you can get the gastrocnemius and soleus. If you're pushing down like this, you're getting the gracilis, you're also getting the pectineus, you're getting the adductor muscles when you're pushing it down like this. So those are the muscles we're concentrating on for this type of stretch then. So again, just watch their emotions of their body, if it's ever too painful. Okay, next one, kind of same idea, but we're going to have this leg straight. So the foot is going to be rotated out like this, and we're just going to walk it up like this then. So this stretch, we're getting more of the adductor muscles and a little bit of the hamstring muscles. So it's getting both those areas. But if you want true adductor stretch right here, we're going to rotate so the foot is straight up and down. You're going to hold right here with your hip and just walk it forward. So that's a true adductor stretch in this area. Okay, next one for the piriformis, the gluteal region. We're going to bring this foot over here. And to get a better stretch, what we're going to do is ask permission to cup the hip. So the iliacus region, we're going to cup and bring it down like this then. And this is a great stretch people should be performing every day, but most people don't. But this helps out, especially with runners, people that have IT band syndrome, those kind of problems. So you can tell in a posture evaluation if their one foot is externally rotated out more than the other one. That means the piriformis, the gluteal region, is more contracted. So that's the area where we're going to stretch out more then. Okay, next one, same idea. But if they can't do a lot of stretching, we're just going to put the foot on this side, on the same side there. Ask permission to cup and just bring it down like this then. In a more intense stretch for that area, you're just going to bring it over here, place their foot on your hip area, and we're going to push down right in there so you can get more of the piriformis. Also the biceps femoris a little bit too. Also the tensor fascia lata right here. And again, you can walk it up too. And if you rotate like this, you're getting a little bit of the gastrocnemius and soleus area that you're stretching out. But the problem is if you don't compress here, you see how the leg's moving, so you want to stabilize and then stretch out that area. Okay, next one, we're going to flex the knee like this, plant the foot on the table, and we're going to perform leg extension, so thigh extension, and also another stretch we're going to perform is dorsiflexion. So we're going to go like this, bringing it down like this. So this is stretching out the rectus femoris right here, and also other muscles of the gastrocnemius and soleus muscles we're stretching out for this area. Okay, next one is going to rotate out the leg. You can do a little traction and pull it out. And you can just hold on the medial and lateral side of the leg and pull it that way. Or again, pull it, traction, into a rotation like this then. Another option, replace the forearm right here. So it's more of a compression stretch. So we're kind of stretching a little bit, but it's kind of compression too. But the gastrocnemius soleus, also the hamstring muscles, just compressing that area. And you can rotate it in different angles too for those areas. Okay, next one, you're just going to bring the leg off the table like this. And what we're going to do is just rotate the leg, externally rotate it. So you can stretch out the pectineus area, the adductors, but again stabilize over here then. Next one, we're going to bring the leg out like this. So the foot is on the table, and if you want a little bit more of a stretch, again ask permission to cup the hip. So you're going to cup the hip and then bring it down then. So if you don't cup the hip, see how the hip kind of lifts up. So that's the reason behind cupping the hip first and then bring it this way. Another option, we're going to go just above the patella here. So you're going to bring it like this. Again, ask permission to cup the hip and bring it down like this. And again, watch your body reactions if it's ever too painful at all. And a third option for this, we're going to put the foot underneath the leg like this. And you can give a little push in. So again, compress and push down for this area. Still another stretch for the adductors. So you're going to bring it out like this, put the foot together like this, and you can either get on the table, but always ask permission of course, or you can perform it like this. So you're pushing down both sides, so you're stretching out the adductors, the pectineus area. Or another option for the adductors too, so you're going to bring it here, you're going to bring it off here, and you're just going to rotate it out. So externally rotate the leg to help stretch out the adductors and the pectineus area. And everybody is going to stretch a little bit different, so it might be these muscles I'm talking about, but it all depends how tight you are in certain areas. So sometimes even with these, they might feel it in their lower back or their hip area. So it all depends on how tight they are in certain areas. So whatever muscle is more tight, that's where they're going to feel it first before it happens then. Okay, now for the arm area and the hand area for stretches, we'll first start with the fingers. So this is extension of the fingers, so we're going to bring them back like this. And this is stretching out the flexor digitorum muscle. So right here we're stretching out the flexor digitorum, so the flexor side. Digitorum means fingers, so again we're going to stretch out that area here. Or you can just perform one at a time. or even 2 at a time if you want. Or you can perform finger flexion. You bring it down like this. So with finger flexion, it's stretching out the extensor digitorum muscles. And again, you can just do 1 at a time if you want, or you can do a couple at a time, or all of them at the same time. Abduction, so bringing it away, like this. Or you can do a little adduction. It's kind of hard, but it is possible. But it's actually crossing it over like this for the stretches. Okay, for the wrist area, what we're going to do is we're going to bring it back like this. So we're going to stretch out the flexor digitorum muscles, and we're going to stretch out the flexor carpi radialis longus muscle, also the palmaris longus muscle we're going to stretch out for here. So a lot of the forearm flexors we're stretching out for this kind of position. Or if you're going to go the other way, just going to bring it this way, and you're stretching out the extensors of the forearm here. So extensor carpi radialis brevis, extensor carpi radialis longus, even a little bit of extensor digitorum we're stretching out for this kind of position. And an even better stretch for those is we're going to hold on to the wrist, not so tight that their fingers start turning white, but we're going to extend, so we're going to traction, and then flex. So that gets a better stretch for that. So again, traction, and then flex. Or you can go the opposite direction, so we're going to extend like this. So again, when you're bringing it back this way, you're stretching out the extensors. This way, you're stretching out the flexors then. Next option, wrap the pinky and also the pollicis, the thumb here. So we're going to bring it back like this. So you're stretching out the palmaris longus mostly, so right in the palm area. Works really nice. So especially people that are like construction workers, people that use their hands all day long for long periods, sometimes this area gets a little bit more contracted. So they can even get a syndrome called palmar fasciitis. So palmar fasciitis is the fascia in this area gets really tight. And there's plantar fasciitis in the foot, so it's the same idea but in the foot region. Okay, next one, we're going to pinky, wrap 3 fingers, and then the thumb, we're going to stretch it out. So again, we're going to stretch out the palmaris longus then. Another stretch for that area, wrap the pinky and also the ring finger, pinky, 2 fingers in here, and stretch out this area. So it's a little bit different stretch for this area. Okay, next one, elbow flexion. This really doesn't stretch much, but if the triceps are really tight, it might give a little bit, but the barrier is the bicep area right here. So it's kind of pushing into the biceps, so you might have to rotate it out a little bit to get a better stretch for the tricep area then. Okay, for a tricep stretch, you're going to bring the arm over the head like this and just push it down. So you're stretching out the tricep muscles here. Another option, we're going to place the palm, the fingers facing down towards the feet, and place it here. And you're going to bring it down like this. But with this stretch, always make sure you stabilize with both your hands. And it looks a little awkward, but it's a great stretch for those areas. Another stretch, you're just going to traction, and you can internally rotate, or you can externally rotate. So the muscles that perform internal rotation, like the pectoralis major, when you go external rotation, it's stretching that muscle out. But if you go on internal rotation like this, it's stretching out a lot of the rotator cuff muscles. So the infraspinatus, the teres minor, and stretching those areas out then like this. Another option, you can place their hand underneath their head like this, and you're just going to ask permission, if the female of course, to compress the pec area and then bring it down. But if it's not a good enough stretch for them, you can have them shimmy their body over here so the arm is off the table a little bit. So if you could shimmy over here, and just their upper body, don't make sure the lower body is over there, so they more stabilized. So you're going to compress, and you can bring the arm off the table a lot more then. Okay, another option, since we have her in this kind of position, we're going to bring the arm straight down then. So again, we're going to bring the arm straight down, but if you don't want to work so hard, you're going to compress the pec area and then bring it down. So it's almost a little bit better stretch in this kind of position instead of just bringing it straight down like this then. And you can perform some traction one direction or the other direction too to help stretch out those areas. Okay, if you can scoot back down there. And if you want to perform stretching for both of them, you're just going to grab the wrist area. And if you want a little bit better with this, have them interlock your wrists. So you're going to pull and bring it down a little bit to get a better stretch of the pec region. So again, this works great right for the pecs. Or you can have them place both their hands underneath their head, right at the inconius region, that muscle right there in the elbow. Just going to compress and push down then. Okay, next one, we're going to perform horizontal adduction. So we're going to bring it this way. And this one's stretching out the posterior deltoid muscle. So we're going to bring it this way. And stretch out the posterior deltoid. And just make sure it's not right on their neck. Make sure it's not right on the breast tissue. Make sure it's right in between there. Right around the sternal notch area. That's where you want to kind of stretch it out. But just make sure it's not cutting off oxygen supply for this kind of stretch then. Next one, we're going to bring the arm up like this. So this is stretching out the rhomboid area. Also a little bit of the bicep, tricep because we're pulling. And also a little bit of with the rotator cuff muscles too. So we're bringing it up, stretching this area out. So this action is called protraction. And when you bring it back, it's called retraction. Okay, next one, we're going to bring the arm over the chest like this. Grab the posterior deltoid area. Compress the hip and rotate it like this. So you're getting some of the serratus anterior, you're getting some of the abdominal region, that you're getting a good stretch for those areas. And you can even have their arm over their head like this to get an even better stretch. To bring it over like that then. Another option, you can tell them to just hold on to your deltoid area and hold on to the posterior deltoid. Also the muscles here, the rotator cuff muscles. So you can compress and just bring and kind of drop your body this way then. So again, it gets all the side areas, it gets your external obliques, the serratus anterior area for that. And while we're on the hip area, what we're going to do is we're going to bring the hand like this, put it on just above their navel, and ask permission to cup the hip again. And what you're going to do with the hip, you're going to push this down a little bit, and then you're going to pull up here. So this is great for like the lower back, the quadriceps lumborum. The quadriceps lumborum is the lower back muscle here. The major action, it raises up your hips, so it's a hip hiker. So again, you're going to bring it over here like this then, so you're raising it up. Or right in the gluteal region, you can lift up, rotating this way. So it's stretching a little bit of the back, but it's also stretching the abdominal region too, and a little bit of the psoas area. Okay, let's go over the stretches for the neck. First one, we're going to perform neck flexion. So we're going to bring the head like this, both hands. So we're stretching out the semispinalis capitis, semispinalis cervicus, and also the trapezius, the upper middle portion, maybe a little bit of the lower portion, depends how much you push it up. But with this one, be careful, because if they can't breathe, sometimes if they have a larger chest area, it can cut off circulation for that area though. So another option for a neck flexion, like this, and you're going to bring it up. So both the hands are on the anterior deltoid region. So again, we're going to bring it up and stretch that area then, like that. And if you want a little bit of different stretch, you're going to bring it this way, or you can bring it this way. So again, with stretching, slow in, maintain it, and then slow out for that area. Next one, bilateral flexion. So bilateral flexion, meaning two of course, and flexion. So we're going to bring the head like this, and with them still staring at the ceiling. So what we're going to do is, don't compress the ear at all, okay? Like this, and like this. And sometimes if you're not getting a good enough stretch, sometimes it's a shoulder, so you might have to push the shoulder down a little bit in order to get a better stretch in that area. So again, cross-handed works a little bit better, so it's better to push than to pull apart then. And for that, it's stretching the trapezius, also the levator scapula. Those are major muscles, it's stretching in that area. And a little bit of sternocleidomastoid. Next option, what we're going to do is we're going to rotate like this. So we're going to stretch out the sternocleidomastoid here. Also a little bit of the levator scapula. So we're going to cross-hand it and kind of push the head down on the table a little bit so you can get that rotation. So neck rotation. But with all these stretches, make sure when you perform one stretch on one side, make sure you even them out on the other side too then. Okay, next one, we're going to perform some traction. So what we're going to do with this one is we're going to hook our fingers right underneath the suboccipital ridge. So right underneath this bone, right underneath the skull. And with this, we're going to pull, we're going to traction. So this is getting all the neck muscles for this type of stretch. Chiropractors, physical therapists are really big into this kind of stretch, especially after car accident. But again, with car accidents, make sure you get permission from a doctor. Make sure they take x-rays beforehand, before you even touch the client, just to be safe. You're going to traction and pull then. Another option is, for traction, you're going to place your hand underneath like this, then your hand on top of their forehead, and we're going to kind of lean back like this. So that's the second option for that. Now the third option, have your hand underneath the skull and then right at the chin area. So right at the chin, make sure it's not on the neck. You're just going to kind of lean back a little bit. This one, definitely test it out on people beforehand just to be safe. So again, you're going to traction. And more than likely, the client will like one of these stretches better than the other. So everybody's going to be a little bit different about whether they can handle these kind of traction stretches. Another traction, we're going to bring it up here, and we're going to put our thumbs underneath the suboccipital ridge. So right underneath the suboccipital ridge like this, we're going to hold the forehead and kind of traction up for that area. So it's getting the trapezius muscle, semispinalis capitis, semispinalis cervicus, and even a little bit of the suboccipitals too. So suboccipitals is the big one for headaches, so it's right underneath and on the suboccipital ridge right here then. Next option for traction, you're going to place your forearm underneath the neck, and you can just kind of rotate, kind of hook your forearm. So I'm hooking my radius bone right underneath the suboccipital ridge and kind of tractioning this way. Or same option, but then you can rotate a little bit too. So again, you kind of hook it like this, or you can place your hand right on the anterior deltoid, rotate it, and stretch it out that way too. So there's many different options, and see which ones you feel more comfortable with, those areas. Let's go over some side stretching. Side stretching is very underrated, but it's more beneficial, I think, for some of the muscles in the body. So with the first one we're going to do is bring the arm over the head, and you're going to stretch out the serratus anterior area, also a little bit of the abdominals, and it all depends on which way you're stretching for this. So if you're doing more like internal rotation, like this, so you're rotating it in, you're stretching out the infraspinatus, also the teres minor, you're stretching out. But if you're bringing it back like this, stretching out more of the pectoralis major area. And you can bring it at different angles too, just to see where it's less restrictive, so you can get a good stretch then. Next one, you're going to place their hand on their head like this. You're going to place your hand right at the scapula. So we're going to kind of give a little push and bring it like this then. So again, you're going to push and bring it back then like this. Okay, next one, we're going to perform more of like a protraction. So you're going to bring it up like this. Or you can rotate it in like this, or rotate it this way then too. Another option, you can place the hand behind here so you can stretch out more of the pec area. So just compress the anterior deltoid and bring the elbow down to the table a little bit. So it's a great stretch for the pec area right there then. Okay, next one, I'm going to push into the scapula and then bring it back like this. So again, stretching out the pecs. And that's an area that most people have problems with, so they're so internally rotated a lot, especially people that are at the computer desk all day long. They need to perform it back, so perform the opposite action to bring it back then to stretch that area out. But most people will love this kind of stretch. It might be a little uncomfortable, but again, it should be more beneficial to them in the long run then. Okay, next one, you're just going to bring the arm over here like this. Ask permission to cup the hip again. So again, some people can be ticklish, and just give a little pull this way. So again, we're stretching out the serratus anterior, also the abdominal region, getting this good stretch for that area. And a good one to kind of get the psoas area, so we're going to bring the leg off the table like this and bring it down like this. So you're even getting a little bit of the rectus abdominis, the external obliques, also a little bit of the psoas major. So we're going to bring it off. You can either compress here or you can compress right at the quad area for that type of stretch. Another option, you can bring the leg, the other area, like this, and then what we're going to do is we're going to bring the shoulder back like this and push this way at the same time. So again, it's getting even a little bit of the erectors along the side of the spine. Also, other muscles it's getting is the abdominals, and even a little bit of the pecs, because again we're bringing it this way, so we're stretching out the pecs for that area. Okay, for the neck area, what we're going to do for that one is just remove the pillow. But just tell them, make sure you're telling them that you're going to remove the pillow. You go like this. I'm going to push the shoulder, just so the top of the deltoid area, and kind of hook my hand right underneath the suboccipital ridge. So hook and push. So I'm stretching out the trapezius, and also another muscle I'm stretching out is levator scapula. So stretching that area out. And if you want a little bit of a different stretch, you're going to push and just rotate the shoulder a little bit. Because some people are just too hypermobile, and you might have to perform different kind of stretches and just tweak it a little bit in order to get a good stretch for them then. So those are different options for that. Or you can place your hand, remember the traction one, we're going to place our hand right at the mandible here and just get a little traction pull for that area. Or you can just kind of rotate the head too, just like a mild rotation. And just do different stretches that way. Let's go over the stretching for the leg in the side position. What we're going to do for this one is place our hand right around the greater trochanter, right here, and bring out the leg straight. So if you're going to bring it up totally straight, it's getting the addis area really good. So again, compress and bring it up in this area. And if you don't compress this area, sometimes it'll rotate out like this, so it's still stretching out a little bit, but it's not a true adductor stretch is what you're performing then. Next option is I'm going to push into the gluteal region and then pull this back like this. So with this one, I'm stretching out the rectus femoris, the main quad muscle, and also getting a little bit of the pectineus and some of the psoas area too. So again, with the psoas, that's the major back problem muscle. It's a major postural muscle in the body too. So that area needs to be stretched out, because we spend most of our day hunched over at desks, so that's why we need to elongate that area as much as we can then. So again, you can even kind of rotate and bring it up here too like this. And instead of pulling the top leg like we did earlier, you can pull the bottom leg too. So again, you're holding on to the malleolus region, the ankle bones. You're pulling there. You can give a little push if you want, or you can just stabilize the gluteal region or the lower back region. And with this one, you're just going to lean back and pull. So you're getting the rectus femoris again, and a little bit of the adductors, a little bit of the pectineus, a little bit of the psoas area. Posterior portion of the lower body, what we're going to first do is bring up the foot like this. So we're going to perform flexion of the knee, and we're going to cup the calcaneus and drop our forearm like this. So with this stretch is where we're stretching out the gastrocnemius and the soleus region. And if you're still not getting enough stretch, you can compress a little bit of the gastrocnemius and soleus region and stretch it out like this. Most people love this type of stretch. So you're stretching, again, you're performing dorsiflexion, so you're stretching out the gastrocnemius and soleus region. The opposite way, we're going to go like this. So we're going to stretch out the quadricep muscles and also the tibialis anterior. So those areas that we're stretching with this. So we're performing knee flexion and also plantar flexion too for both of those types. Okay, next option, we're going to push into the sacrum region and push in and bring it this way. Or push it in and bring it this way then too. So this is getting the gluteus and the piriformis region when you're stretching it out. Like this, back and forth. So you do an internal and external rotation. Another option, thigh extension or leg extension. So we're just going to bring it up like this. So just compress your elbow in right in the center of the gluteal region, not on the sacrum at all, so no bony areas, and not on the greater trochanter. So we're going to stretch out the rectus femoris and also the adductors a little bit. It all depends on which way you're going to bring it. So if you're going to bring it out a little bit, you're going to get those areas you're going to stretch out a little bit more. Next option, we're going to cup the patella like this. Place your hand either in the gluteal region or the lower back area and just bring it back like this then. And if you need to, you can lower the table even more and you can put your knee up on the table so you can get a little bit more support and bring it back then like this. Or another area, you can even place your hand on different areas of the back and bring it up. So again, I have the opposite leg, or you can have the same leg too, like this. And if you need more support, again, you can make sure the table's low enough so you can get your knee on the table comfortably. Just go like that and bring it up in those areas. Next option, we're going to bring it like this and this. You're going to push it down a little bit. You can even ask permission to cup the hip and kind of lift it up too. So you get a little bit of the tensor fasciae lata, also the vastus lateralis. You're stretching that area out a little bit. Or another option for like the lower back and the quadratus lumborum muscle here. You're going to ask permission to cup the hip, of course. Cup like this. You can lift up and then push down at the same time. So again, you cup, lift up at the same time. So you're kind of twisting this area is what you're doing for lower back problems. And most people love the stretch for lower back areas. And another one for like the gluteus, the piriformis area, you're going to interlock like this and just compress right here in the gluteal region. It's more of a compression stretch, but those are considered stretches too, so it's just a different option. And also you can perform it in the lower back area too. It's a great stretch. Okay, next one. Remember how we brought it out like this and pushed in here? But then you can push into the lumbar vertebrae area. So you don't want to push straight down because of the kidneys. We're just going to push into the quadratus lumborum and just give a little stretch this way. So you're getting the quadratus lumborum area a little bit, and also other muscles you're getting here is the adductors. You're kind of stretching out in this kind of position then. For the upper body portion for the stretching in the prone position, what we're going to do is we're going to bring the arm like this. So you can traction the different angles, of course. So when you're bringing it like this, it's called internal rotation. So it's stretching out the infraspinatus and also the teres minor area. So bring it like this, stretching that area out. Or if you're bringing it like this, again, it's stretching out like the anterior deltoid, the pectoralis major area. So you're rotating it out, so external rotation like this then. Next one, like this. We're bringing it up like this. We're stretching out the pec area. Or you can perform both at the same time, like this and this. And another option is you can bring the arm up like this, so we're getting even more of the pec area to stretch it out then. What we're going to do for this one is place the hand back of the head, place your hand right in the rhomboid area, so right in between the scapula and right in between the vertebrae. Compress and then pull up then, right here. Or you can perform it both at the same time. So you can bring the hand like this and this, interlock, and bring it up at the same time then. Okay, next option, You're going to cup the anterior deltoid area and just bring it up. So again, you're stretching out more of the pec area. And you can place this hand like in the mid back, lower back area, so you're just getting different muscles that you're stretching out when you're stretching like that then, for that area. And with the head area, you can perform neck extension. So we're going to bring the head like this, place your hand on the forehead, and just bring it up like this then. So you're stretching out the platysma, it's the most superficial neck muscle. And another muscle you're stretching out is the sternocleidomastoid, like this. And you can bring the head like this, compress the head a little bit, and the shoulder at the same time. Or, again, rotate like this here, but just push it a little bit. You hook the suboccipital ridge here, so you can stretch out the sternocleidomastoid, a little bit of the levator scapula, the suboccipitals. So you're pushing this way, and sometimes the shoulders in the waist, you can push the shoulder down more, so you can get some better action this way then. Okay, this next technique I want to demonstrate is called muscle testing. Some people call it applied kinesiology too, so that's another term. But with applied kinesiology, muscle testing, we're performing tests on the muscles to see what areas to treat then. So again, us as massage therapists or people that have just performed stretching, those kind of things, we cannot diagnose anything. We can just tell if a muscle a little bit more weak or if you're having problems in that area, so that's what we're doing is we're testing those kind of things. So what we're going to do is have them bring their pinky and their pollicis, their thumb together, and you always want to make sure you do a neutral test first. So what you're going to do is you're going to try to separate that. When you try to separate it just a little bit, so you want to just separate the pinky and the pollicis just a little bit, and that's your neutral. So you always perform that first. The next one, what we're going to do is we're going to swipe a muscle. So we're going to, again, you're going to test that, a neutral one first. Relax, swipe it, and then do it again then. So again, when you swipe that muscle, it's stimulating the nerve endings and it's letting you know whether that area is weak or not. So after you do that, let's say that's weak, I'll treat that area, I'll do whatever I can to help stretch it out, to massage it, those kind of things. And then afterwards, what I'll do is I'll do a neutral test again, then swipe it, and then see if there's any kind of improvement then afterwards. So again, that's applied kinesiology kind of treatment then. So that's the most beneficial. You can do it on anywhere on the body, so you can even tell them certain areas too. So you can, like this, you see, let's say right shoulder. So you can see if there's weakness or not, or if there's an area that you need to concentrate on. You can go right shoulder or left shoulder, and it doesn't even have to be on the same side of the body either. So again, when you're just saying those kind of things, but sometimes if the person doesn't understand muscles, try not to use those kind of terms. Just use areas of the body. So the quicker you do this, the more accurate it is. So if you, let's say you perform this, and do a neutral test first, and then say right shoulder, then you wait for a little bit, and then they can think about it and they can actually resist better. So what you're going to do is you're going to do a neutral test real quick and do it really quick. So say right shoulder and then do the test right away and see if there's any difference. So again, the quicker the better. And again, this is not 100% accurate, but it's more accurate than just guessing in these kind of areas. Some people believe it's even 75% plus accurate for these kind of areas, but you just want to make sure you perform this many times before you really perform it on the public for those different areas, because it takes a while to really get used to the different kind of strength. So you want to make sure you use the different kind of strength each time you try to pull that area apart. And after a few times, their fingers might be a little bit fatigued, so you can use different fingers also for these areas. So it doesn't have to be just those areas. And you can even use it with the arms too, so have them try to resist, try to flex kind of thing. So you can swipe an area and sweat and see if there's any difference with that too. Okay, so that's applied kinesiology kind of technique. So again, we can't diagnose, but this is a way to try muscle area problems beforehand. So it works really beneficial. So it's something you can chart too, so you can document that. And sometimes when the client sees it, sometimes they're just in awe, but after a while they're just amazed at how accurate it is, and especially if they see improvement afterwards. If you perform it again when you're done treating that area and they notice improvement, they're more likely to come back to you when they're actually seeing those kind of improvements then. So again, apply kinesiology. Next one is called the end field test. So with the end field test, what we're going to do is it's like a bouncing kind of test. So you're going to bounce one side and bounce the other side. So this can be performed anywhere as the body. So you can perform here, even the sides, especially with the ankles, any joint region. So with the quads, you can perform it too. But you're just going to kind of push one and push another one. And this is kind of hard to analyze, but the one that doesn't bounce back as good, that's why they call it the end field test. The one that doesn't bounce back as good, it's protecting a little bit more, so that's why you want it to kind of bounce back really good afterwards. So it's just a different way of testing out things, is called the end field test then. Another option is you can test out the fascia in the body too. And with that, you're going to just use your fingertips. You can just go up and down or different areas in the body. So see which way is more restrictive. And the area that's more restrictive, that's the area you want to stretch out more in those areas then. So again, more of a palpation kind of stretch for the fascia is what you're trying to do. So you're going to try to look at the flexibility. So you can compare one side to the next, even one quadrant to the next quadrant kind of thing. So there's different quadrants in the body, so you're just testing, let's say the shoulder area, then this area, so see which one is more resistive and which area you want to concentrate on more. So that concludes our form of muscle testing. So that's just different options you can incorporate into your treatment then. Thank you.